how can we say things? How can we use our voices for good?
Good morning and welcome to another episode of Recipe for Success. For those of you joining me for the very first time, this podcast was born out of my love of cooking combined with my curiosity for essentially all things. As I was cooking one day, I started thinking about how there's always one key ingredient or technique that's really crucial to the success of whatever it is that you're making. And if you think about it, that same can be true of business, life, hobbies, whatever it is. There's always something that really can make the difference. So I'm really excited for today's guest, Dr. Cheryl Lee Eberting. And I have to put my glasses on because her bio is quite impressive and I actually need to read it to you. So Cheryl, am I saying Eberting or Eberting?
Eberting.
Eberting. Okay. Wanted to get that right. I hate it when I pronounce people's names wrong. Dr. Cheryl Lee Eberting is the CEO and founder of AZOVA. Dr. Eberting is a board-certified dermatologist, former NIH scientist, a digital health technology entrepreneur, and a healthcare visionary. I mean, really. Her leadership has earned AZOVA the title of the fastest growing company of Utah, and she was awarded the Ernst & Young Entrepreneur of the Year for the Western region. Extraordinarily impressive. Dr. Eberting grew up in my neck of the woods in Bellevue, Washington, and now resides in Utah, where I was a week and a half ago. So I feel like we got all the synergy going this morning. She's the mother of 4 children and loves solving perplexing healthcare problems. She's known for her creative approach to solving difficult healthcare problems by integrating the science of Eastern and Western medicines, huge fan of that, to find the most logical and safe approaches to healthcare. Okay, I'm tired just reading that. That is so impressive. You are very accomplished. I'm so happy to welcome you to the show. I would love to kick it off by letting you tell the audience a little bit about yourself, your career path, and what drew you to transition. I know you still do some hands-on practice, but what drew you to founding AZOVA?
Yeah. Well, first of all, it's great to be with you this morning. Thanks so much for having me. So first of all, I'm a dermatologist and I also consider myself a scientist and will always be a scientist first. And I started my career at the National Institutes of Health where I treated people who have a disease called Job syndrome, named after Job in the Bible. And they have all kinds of problems, just like Job did, but their worst problem is the worst eczema in the world. And at the time, there were about 144 people in the world who had Job syndrome. It's very rare. And at the NIH, we had seen 104 of them. And so I got to be really good at treating really bad eczema with really bad products and decided that one day I'm going to create the most correctly engineered products for people who have sensitive skin, which is all of us. And I also specialize in chemical allergies, so chemicals that come in contact with your skin. I spent about 5 years developing that technology and then launched it with a Utah mommy blogger in 2014. And literally within a couple of days, we had people from all over the world emailing photos of themselves and their kids to my sales guy, asking my sales guy to ask me to diagnose and treat them over the internet. And it was actually a picture of this baby from Algeria that was covered head to toe in scabs. And I was like, you know what? I know how to treat that. That's my superpower, right? Eczema is my superpower. If I could teach that baby's doctor how to do this, with all these things that I've learned, imagine all the cross-pollination, all the doctors you could help to help their patients, how many patients you could reach and how many people you could help over the internet. It's like, right. And so that's where the idea for AZOVA was born. So literally on that day, the picture of that Algeria baby that came in is when I started working on AZOVA. So that's a little over 10 years from now. And anyway, so at that time, really, my idea was not just dermatology over the internet, it's healthcare, all of healthcare over the internet, built around the consumer. I have always been very interested in the consumer experience of healthcare. Like I'm obsessed with that and always have been. Had some experiences in my very first few weeks of practice that really influenced, we as doctors need to think about the patient and how this experience is working for them, right? You can go to Burger King and drive through, bacon, lettuce, onions, tomatoes, cheese, whatever. People are not hamburgers. And the operations of healthcare are much more complex than a hamburger. But people want to access their healthcare the same way that they go buy a hamburger, right? And so we as healthcare providers need to figure out and get our operations, exercise operational excellence in healthcare. And so anyway, with that, the goal really is to connect the whole healthcare ecosystem around the consumer, but not forgetting the provider. It's got to be awesome for the provider as well. And really modernize, our goal is to really modernize the healthcare experience for providers who are delivering it, the healthcare experience for the patient who's accessing it, for the entities that are paying for it, which includes the patient and their employer and, whoever's paying for it. It's got to be awesome for everybody. Everybody's got to win. And so anyway, that's a bit of our origin story.
I love it. I left this comment up here because I wanted you to see it. So Alex says, best doctor and boss in the world. So apparently you have your own fan club, which is awesome.
Thank you.
I didn't have this question, but I am curious, where did the name AZOVA come from?
It's kind of a play on AZOVA. Healthcare as we know it is over with AZOVA.
Oh, I like that. I like that. Very fun. Okay. So you and I chatted, I don't know, it's been a month or so ago when we chatted, and I learned a little bit more about you and what you do. But one of the most fascinating things that I learned from you was that AZOVA was a leader in processing and proctoring COVID tests during the pandemic. So how did that come about, and what did you learn from the process?
Wow. When COVID hit, we had just launched this newly patented network connecting technology that we have, where we can deploy networks of pharmacies, networks of imaging centers, networks of providers. And we were just getting into this employer health benefits, we were getting our jam going, right?
Right.
And then the pandemic hit. We had also just started working on at-home lab testing at the time. We were able to get distribution of the first two at-home COVID PCR tests. This is before the rapid antigen tests were available. The first two at-home COVID PCR test kits, and then got them into Costco, and then Delta, and then Alaska, Virgin, WestJet. We were then selected as one of the health passes for the state of Hawaii because we had already built this very robust, globally shareable electronic vaccination record system. Our whole platform is built around your patient data, being able to take it with you wherever you're going. And so that infrastructure that we already had in place was what was needed during the pandemic. And, the telehealth, we're already doing the telehealth. And so for travel and COVID testing, proctoring was necessary, right? If you wanted to go on a plane to go pretty much anywhere, you had to have a validated lab report, right? And so we went from about 30 employees to 600 employees in 45 days.
Oh.
And we were proctoring between 12 to 15,000 tests a day, enabling people to travel all over the world. We had lab networks in 11 countries at the time, ultimately sold, around 30 million COVID tests during the pandemic and helped a lot of people.
So let's talk about this, because I think that what was interesting, of course, that is mind-blowing in and of itself, but you didn't just proctor tests. You actually monitored the results, and you compiled the data to see what you could get from it. And then where did that lead you?
So that actually led us to be able to manage COVID compliance programs for our clients. So California, for example, is a particularly very complex one. There were some cities that had different requirements than
Seattle,
than the county,
yep,
than the state, right?
Yep.
So if you're a school district and you have employees in 5 counties and 7 cities, and each one has different rules for whether or not you have to be vaccinated, or if you have to be tested, or what kind of test you have to be tested by, or the time frame in which you have to be tested and vaccinated, it was crazy. So we built a full automation so we could set up, an organization. Okay, we ingest your eligibility file of all your employees and their location, hit it up against the rules engine that we've built for those locations, automates it all so it tracks everybody's vaccination records, their COVID testing records. But it really, enabled us to have a lot of insight, people who are vaccinated, still testing positive, those kinds of things that you can really get insight to when you have that kind of data.
That's awesome. Okay, so one of the other things, so of course, I'm a lurker, or I should say a stalker. I'm not really sure how you would phrase it, but I like to know as much as I can about the people that are going to be on my podcast, what their companies do. So, of course, I comb through the websites, and according to the AZOVA website, you have something called the Healthcare Virtual Preventive Exam, which is described as a complete preventive exam from the comfort of your home. Okay, sounds amazing, but tell me about how that works.
Yeah. So the HealthBox Virtual Preventive Exam is a kit that we ship to your employee's home. The kit includes a finger stick blood test kit, a blood pressure cuff, and a measuring tape. And this is, first of all, is for those who never go get their preventive exam, and even for those who do, it's a super, super convenient way to get your preventive exam and enables you to do it from home. So the blood test inside, this is a finger stick blood test kit, is a full lipid panel, AST, ALT, so liver function, TSH, thyroid, EGFR, creatinine, kidney, A1C for diabetes, HSCRP is a cardiac inflammatory marker, and vitamin D from a blood stick, from a finger stick. So you take your test, mail it in, results come back, and then we send you a link to choose your choice of primary care provider in your state. And then this is where it gets really cool. We've created an algorithm based upon the United States Preventive Task Force Committee guidelines that enables your primary care provider to identify, okay, these are all the screenings you need. This is what you're at risk of. These are the chronic conditions that we've identified and detected. We complete behavioral health assessments, sleep assessments, nutrition assessments, exercise capability assessments. All of that comes into this algorithm to create what we call your Health Vitality Index report. And that's a comprehensive report of what you need. Really, really helping the consumer get their set point. Okay, this is where I need to focus.
So if I understand you correctly, and maybe I'm not, so all of that information comes from the health box preventive exam.
Yes.
Before, and then goes to the doctor if somebody chooses to take it to their doctor.
Well, it comes with the visit to the doctor. So that's
okay.
That's part of it. So first of all, AZOVA is a nationwide network. So we have about
Okay.
2,000 providers in our nationwide practice. It's actually different than a network. It's actually a practice that
Understood.
covers all 50 states. So we have primary care providers, pediatricians, psychiatrists, therapists, dermatologists, sleep providers, doulas, covering all 50 states. And so you choose a primary care provider from our practice who leverages the technology to help you do that.
Okay, perfect. So I just want to be clear to the audience that may be listening. This isn't going to be sent to Dr. Jones that you've been seeing for 30 years. This is going to be sent to a practitioner who understands how to read and leverage this data to optimize your health. Is that correct?
Yes.
Okay.
Yes. And then the important thing is, so we sell the preventive exam as a standalone product or as part of what we call our whole health membership. And the whole health membership is actually launching in beta this year with a few select clients. The whole health membership is now, we're going to help you and be your primary care and manage your care for you long term. The whole health membership really integrates all the behavioral health. So from the members dashboard, you can access a psychiatrist, a therapist, your dermatologist, a clinical pharmacist, all of that from a single dashboard, and enables all of your providers to collaborate, communicate, share records together, leverage the algorithms that we've created, and will continue to build over time.
I think that's fabulous. Okay. I think you kind of answered this question already, but I'm going to bring it up anyway, because it comes up every time I ever discuss virtual care or telehealth with clients. There is a concern, and I think legitimately so at some level, that people are worried about going from people treating people to algorithms treating people, and then there being somebody just to facilitate the algorithms. So it seems like your model is special and unique from what I've seen, where you're using all the advantages of technology and combining it with a real live practitioner who knows how to read that technology and best assist the patient to get the quickest path to their healthiest self.
Exactly. It's leveraging technology in the right way. You should never let your technology make your decisions for you, right?
Yeah,
But you should leverage your technology to give you all the things you should be considering and take into consideration before you make it, you, the physician, make the decision, but really making it easier. The United States Preventive Task Force Committee guidelines, for example, there are thousands and thousands of data points that a human brain could not possibly remember every single one. We're going to remember the really important ones, but wait, there are these other variables that you didn't consider that you should, right?
Right.
So it's really augmenting, the strength of the physician, help them to make their job easier, and help them to take care of their patients better.
I really like that approach because I'm one of those people that will try out anything on myself. And so I've done telehealth visits where it's just we'll call it a doc in a box, whatever you want to call it,
Yeah.
where it's nobody it's not actually a provider, where they immediately want to prescribe me something for something I don't actually have, but that's just their MO because they're going through their 5 questions and they want to get me on some antibiotics. I'm like, no, that's not really what I need.
Yeah.
And on the other hand, I've also been to in-person physicians that literally I could have been invisible because they're just, sitting in there and, they come in after you've talked to 5 other people and told them the same thing 5 times. They read through the notes, they look at you and they're like, good, and basically that's the whole conversation with the doctor. So I think that this approach really is the best of both worlds coming together to make the experience better for the provider and the patient at the same time.
Yeah. Yeah. And that's just it. I mean, I think you hit the nail on the head. Ultimately, the long game of digital health, there will be a good 80% of what you currently, 80% of your healthcare that you currently access by taking the day off to go somewhere and sit in an office, 80% of that will be automatable,
I
right?
like
Over
that.
time,
Yeah.
not right now, but we're going there, right? Like sleep, for example, we're launching a nationwide sleep management program. You can't manage 100% of sleep online, but you can manage 85% of sleep online and have an awesome experience. Would you rather wait 17 weeks to go to a sleep lab or one day and do an overnight sleep test and get what you need? So there's
Right.
so many things that you can automate.
I like that. Okay, so let's talk about preventive care in general because most people don't understand what preventive care is. So let's start off by defining that because in the terms of health care, preventive care is dictated by the US Task Force, Department of HHS. There's a list, anybody can look it up. The services on that list are considered preventive from an insurance standpoint.
Mm-hmm.
Now, from a person standpoint, other things may also be considered preventive care, but people do need to understand that just because you're doing something that could potentially prevent things down the road or early diagnosis does not mean, again, from an insurance standpoint, that insurance is going to consider it preventive. This is something that I've spent 30 plus years trying to explain to people, and it's still a struggle. One of the ways I like to describe it is preventive care is when you take your car in every 5,000 miles to have the oil change and you have your tires rotated. Diagnostic care is when the light on the dashboard is blinking at you, telling you something's wrong and I need to take
Yeah.
it in.
Yeah.
So I think that's a really simple way to look at it. But what I really want to know is why are people so reluctant to actually get the preventive care they need when they know that 75% of illnesses can be prevented if they're detected early?
Well, I think, first of all, people in general don't understand that, right? They are of the mentality, the blinking light, right? And I think that's part of the human fallacy, right? We're all like that. Go, go, go. I got so many things going on. Don't take time to take care of me, right? And I think we as physicians and healthcare providers really need to step back, and really make that the number one priority. But I think it's also due to the adversely aligned incentives in our healthcare space in general, due to the longevity of a member on a plan, right? So
Mhm.
you're, you're my hot potato. You're only going to be here 18 months. I don't care what happens to you in 36 months.
Right.
Right. And, we all know that is just how the health plans are. And God bless them, can't blame them, right? If it's not on my balance sheet, I don't want to pay for it. So I think we really need to switch the onus to the consumer themselves. Hey, they're not going to watch out for you. You need to watch out for you, right? because you're going to be with you your whole life, right? And really teach the consumer how important that is. And I think it's really a matter of education, education, education. And this is, preventive care is my favorite thing to talk about. I am so geeked out on the science, so geeked out on the data, so geeked out on the massive opportunity, the cost-saving opportunity, both the short and long-term cost-saving opportunity, but more importantly, the long-term morbidity for yourself that we can save, with preventive care.
And the guidelines are always changing too. The guidelines around mammography has changed. The guidelines around colonoscopies have changed. So people are a little bit unsure, well, when am I supposed to do this stuff? But if we just do baseline preventive care just starting with baseline, a good blood workup, a good panel, just like you're talking about with the health box, a physical assessment, a mental assessment. If we just did those things, we would be so far ahead.
Yeah. Well, it's doing those things and then being able to act upon them and having access to the care. So it's the if what, now what. Okay. And that's really where AZOVA comes in, is we are building all of these now what patient care funnels to help you easily access the care that you need for that. So one, for example, is prostate cancer. Okay. So I don't know if you're familiar with the whole PSA and, the conundrum with PSA.
I am.
Okay. So PSA, so prostate specific antigen, for example, is technically not, it's not recommended. It's if the man wants to check themselves between the ages of, I think it's 40 and 69. Because if your PSA level is low, the sensitivity of the test is low. But I don't know about you, I would want to know where my
Right.
PSA is, because I might be one of those not uncommon people who actually does have prostate cancer. But the problem is the limitation of that test, right? So the test, the higher your PSA is, the sensitivity will go from 33% to about 51%, meaning it's a correct positive. The specificity, so a correct negative, is high in both cases. It's 93%. So what do you do? If you are one of those people who wants to be screened, and I still recommend everybody get screened, but get screened the correct way with a plan, right? So what is your plan if it's high? Are you going to run out and get a prostate biopsy? No, don't do that. Right? So track your PSA over time, see what your trends are, follow your trend, not your single point in time. And then there are some new, really amazing technologies, epigenetic testing that can be paired to that PSA that are highly predictive and that can save you from an unnecessary prostate biopsy. So it's really digging deeper. Okay, just because the PSA has a situation, well, what can you do? How can you leverage that PSA? Maybe pair it with some genetic testing that then makes it really powerful. So there are all kinds of things like that in healthcare that can really help you to get to the best answer.
Okay, so you just spoke my love language when you said genetic testing, because it's one of the things I'm extremely passionate about in this industry. There are a lot of genetic tests that are not super expensive. There are some that are more expensive, but they're usually associated with more expensive conditions. But getting the right drug at the right time for the right condition is critical to good outcomes. And most insurance companies aren't paying for it. Because they're like, well, that's just an extra cost. But if we talk about something like a Humira, or anything that we're talking about from that standpoint, where we're rheumatoid arthritis, there are two types of drugs that can be used to treat that. They're both biologics, but they run on different pathways in your system. And if you start on the wrong pathway with the wrong drug, you're automatically decreasing the potential for effectiveness with the second drug. So it logically, at least in my non-scientist brain, I automatically think, well, I would rather spend $500 for this test than waste $15,000 for 3 months on a drug that's not working, and then reduce the potential for the other drug to work in the long run.
Yes, I completely agree with you. And, there are technologies like, I'm so excited for the next 10 years of healthcare. Like, it's just mind blowing, all the fun stuff we're going to be able to do.
Yeah, it's very cool. Well, I'm a big fan. I mean, anytime there's an opportunity for a genetic test before something happens, I say at least consider it. Yeah. At least consider it.
I'm with you.
Okay.
You can waste a lot of money on a hokey genetic test, though. So
Very true. So you need to make sure.
On that. Yeah.
Yeah. Okay. So you talked about this in a little bit in the very beginning. So that you are a dermatologist by trade, and that is where you discovered that you were going to create products that would correctly treat severe eczema and severe sensitive skin issues. So you're also the founder and CEO of Cheryl Lee MD Sensitive Skincare and your own dermatology practice. I do not know how you find the time to do all these things, but pretty impressive. But I'm interested because, well, I'm an older woman. So, of course, I'm interested in skincare. So I'm curious about, just tell me a little bit more about that company and the products you have. And I know that some of them are very specific for very severe conditions, but is that all it is?
So Cheryl Lee MD or CLMD.com it's for everyone. Okay. So every single human on the earth has sensitive skin, and every single human on the earth should not be putting a bunch of chemicals on their skin. Okay. And so I am obsessed with the chemical allergenicity, toxicity profiles, teratogenicity profiles, reproductive hormone disruption profiles. You need to know that about what you're putting in your body and what you're putting on your body. And so every single molecule that is in our products has gone through this very rigorous, review of whether or not it passes the muster to be included. But there are two lines. One's called True Lipids, and the other one is called True Cider. The True Lipids line is a skin barrier optimization line. The other is a skin barrier acidification line. And we have what we call the Timeless Trio is our number one selling combination of products. It's a cleanser, serum, and lotion for age prevention. But we also use it for mild acne. But then this is where it gets really cool is we add in compounding protocols. So we work with compounding pharmacies and have protocols for all things dermatology where you can use these proprietary, patented, totally hypoallergenic, non-toxic compounding bases and have your topical prescription compounded in those bases. And so we have paired these over-the-counter products. Anybody can just go to the website and buy whatever is right for them, with the ability to see a dermatologist online. So if your acne is really bad, we compare a compound with the topical regimen, and you get the best of both worlds.
I love that. Okay, I warned you that I do have the tendency to go down a rabbit hole. So, okay. Rabbit hole incoming. I will give you the warning. This is completely different, but because you are a dermatologist and you are so knowledgeable about things that are being put on people's skin, I again have a concern about a lot of these young girls just slathering on products indiscriminately at 12, 13 years old. And what is that going to do to their skin long term? I mean, I grew up washing my face with a mild soap and water and, putting a little bit of Neutrogena or something, oil of Olay on my face at the time. But I see these people just putting tons and tons of product on their face. And again, my logical brain, not my scientist brain, says that's not going to be good for them long term.
Less is more. I am completely with you.
Okay. Yep. Just wanted to make sure I wasn't crazy there.
Yeah, I'm with you. No, I was chatting with a little neighborhood girl who is 8. And she is like, I've got a skincare regimen. I want this and this. Like, that's what she wanted, was all the skincare for her birthday. It's like, no, you're way too young for that. So
I saw that. Yeah. Around Christmas time, I saw it on the news that they said that was the number one requested gift item from girls, I think between 8 and 16 was skincare products. I'm like, I don't remember doing anything to my skin when I was that age, except I was lucky I washed it. That was about it.
Yeah. Well, the good thing is, these products, you can safely use them. You can use them when you're a baby, when you're a newborn. You can use them when you're elderly. They're designed to be used as much as you want, as safely as you want.
Okay, so I'm going to pop back again because, again, there's a little pinball machine going on here. So AZOVA, individuals can access it as well as employers?
Yes.
Okay.
Yeah. So we offer, our primary business is for employers, and have a whole team that helps you to manage and implement the program. As I mentioned, we're launching the beta for the Whole Health membership, and the Whole Health is really kind of the aggregation of the last 10 years of our work. And it's the whole, it's the beginning of the whole grand vision coming together, right? I kind of think of Jeff Bezos's books is our preventive exam,
Yep.
and then from the preventive exam, we can now manage so many things for you. As I mentioned, over time, we'll be able to manage 80% of your healthcare over the internet virtually. So that's where we're going. This membership includes, you have access to primary care, includes 780 medications that are completely free of charge. That not only are they free, but they're built into the protocols for the providers. So we will, by default, if you need that medication, you're going to get the free one, right? We don't, we can't do specialty meds, of course, but it's built the right way from both the clinician standpoint and from the patient standpoint and the employer standpoint. It also includes coaching. So, okay, you're hypertensive, you're type 2 diabetic, and you're a little bit overweight. We're going to match you up with your own personalized health coach who is collaborating with your primary care provider. There are so many vendors out there that, I'm a standalone diabetes vendor. We know that doesn't work. Okay. You can't do that in a vacuum. Your primary care has got to be involved. You got to be tweaking your medications because as you lose weight, you don't need so many medications, right? So all of those things need to be considered. And that's what we've worked for years and years to get to this point.
Yeah, it really, I mean, from my perspective, it really is a best in class solution because you are tying, it's almost elevating direct primary care to another level. And I think that combining it with the technology and your network and referrals to live people, honestly, it's very exciting, and I'm very excited for you to see where this can go. So
thank you. Thank you.
It's amazing. All right. So enough geek talk. We get to have some fun talk for a minute. So it's time to move on to the fun part of the show, my 5 burning questions. You've seen them, so hopefully you're a little bit prepared, but I used to not give these to people in advance, but then it freaked them out too much. So anyway, question number 1, what is your absolute favorite food in the world and can you cook it?
My favorite food is, wait for it, salad.
I'm guessing you can cook that.
Yes. Well, it's kind of cheating because then I don't have to commit to any one food. Right?
Yes.
So, because there's 1,000 salads
there is.
make, right?
But I do. I like that.
No, I am a sucker for a good salad. And yes, I can make it.
I mean, I love a good salad. I love all salads pretty much, except those mayonnaise-based ones. But
I don't like the mayonnaise ones either.
But I don't think I've ever heard anybody choose that as their favorite food. So
Yep.
winner. Okay. So what character trait do you admire most in other people and why?
Kindness. So which is why I married my husband. So I think if someone is kind, A, you can trust them. B, you can get along with them. C, you can do lots of things together. Right?
I love it.
They're going to consider you and you're going to consider them. I always counsel my children, the most important thing when you go to choose a spouse is if they're kind, because if you have that, you can figure anything out.
Yeah, I like that. Okay. So now I get to turn the tables on you and say, what character trait in yourself are you most proud of and why?
So I tell people this. I was voted most likely to raise my hand and ask a question at my own funeral in medical school. And like the end of the year, like the end of, everybody gets nominated to something. That's what I was nominated for. Anyway, and I was like, what? But it is, as I've done what I do, I realized, well, that is kind of my superpower. It's the way that I build information and connect these random, what would seemingly be unconnected dots into, hey, there's a clue. Anyway, that's kind of my superpower. Even in developing my skincare line, when I was pregnant with my 4th child, I have 4 kids, and he was about due, and I was like, I gotta get this thing done. And I had like stacks of all these research papers, trying to like solve this skin barrier biology thing. And I remember I read this one article that it was like, eureka, like all those little things I had read, like cinched them all together. And so I think that's, kind of a random trait that I've got that I leverage in everything I do.
I love that. So I think I would title that Insatiable Curiosity.
Yes. Yes, I think so.
I like it. Okay. So what's the one thing you would love to see that would most help or enable clinicians practicing today to provide a more personalized experience to the patient? Because the majority of providers, of clinicians, are not providing any personalized care at all.
Yeah, Nancy, we both know what it needs to be,
Yeah.
right? The consumer needs to be able to communicate with their provider.
Hmm.
Like, hey, Dr. Eberting, I have a question. Oh, you can't talk to me. You got to pay me, right? Unfortunately, like the business models in healthcare don't enable that because the doctor does need to get paid for their services.
Of
It's
course.
not like an attorney. I can say, oh, I spent 2 seconds. I'm going to send you a bill for my 2 seconds. But I think, if we could wave a magic wand, it would be communication, the ability for the consumer to communicate with their provider, which we have fully enabled that through AZOVA, and collaboration. So collaboration between providers, you can save so much time, so much money, so much morbidity, wrong decisions by getting better information, better collaboration, better communication between the providers.
Yeah, I would agree with that. I had a hip replacement back in December and I had an allergic reaction to the tape. And so when it came off, it was like my skin had been burned. And so I wanted to call the surgeon's office and explain to them what was going on. Well, there's no way that when you call, you can't get through to a person unless you say you want to make an appointment. So of course I do that. And I'm like, I just need to talk to somebody. And they tell me, well, you can't talk to anybody. You have to submit a message through my chart, which says they will get back to you in 24 to 48 hours. I'm like, I actually need an answer about this because I don't know. Do I need to go to urgent care? What should I do about this? Because it's kind of ugly.
Yep.
So eventually, so I submit the question. They get back to me. It's not a nurse. It's just an admin, which is fine. Says, well, doctor says to, upload a couple pictures. So I upload the pictures and doctor doesn't call me back. It's some admin person. He says, so again, it's like we're playing a game of telephone. I'm telling one person who's telling another person who's telling another person.
Annoying.
And then it's coming back in the same method. And then the information they gave me, which they told me to use a Benadryl cream on it or whatever it was. It made it worse.
Actually won't help it. Yeah,
Well, not only that, it actually aggravated it and made it worse. And so then I had to repeat the process of trying to get them to understand that that wasn't working. It's all good now, but I mean, that's just just a silly little example of a quick 2-minute question could have been resolved instead of it taking hours of this handoff game.
That's what I mean by the communication thing. So like in our whole health membership, you also have access to 24/7 virtual urgent care, but you also can ask free questions to your doctor, right? If you got a quick question, just ask them, dang it.
Yeah.
Yeah. So, but you really just needed a dermatologist and a topical steroid. But what's even worse is when you're reacting to the Neosporin, because every doctor in the world is programmed, put Neosporin on that.
Yep.
And Neosporin is actually one of the most allergenic things in the world and is commonly diagnosed. An allergic reaction to Neosporin is diagnosed as an infection. So they give you antibiotics for your allergic reaction. But you needed to see a dermatologist.
That's crazy. That's crazy. Okay. What is your secret talent or something people would be surprised to learn about you?
My secret talent is something I think I just intuitively learned from my mother, is being able to read people.
That is a good one.
Like read them like, I don't know. It's not like I'm a palm reader or something, but I don't know. It's intuition, right? Being able to understand where you're coming from.
I like that. All right. Last question. Who is the one person, famous or not, living or not, that you would most love to be able to sit down and have a cup of coffee and a deep conversation with?
I thought long and hard about that. And I would want to meet with Jesus. Like, he made this place. He made our bodies. Like, I can't wait to learn what he knows.
Yep. That is great. That is amazing. Okay, well, this has been a fabulous episode. Thank you so much for joining me. If people want to learn more about AZOVA, they should go to the website. What was their next steps? What are their next steps?
Yeah, so they can go to azova.com. If you are an employer, we have a section for businesses and organizations. You can read about some of our products. If you'd like to talk to us, you can just submit a little form on the website and we'll reach out to you.
And if you forget all of that, you can always send me a message and I will connect you. So I'll make sure that you get put in touch with the right place. So thank you so much for joining me today. And for the rest of you out there, thanks for joining us as well. I hope you enjoyed it as much as I did. And I will see you next week.
Thanks so much, Nancy. Bye-bye.